Hi, I'm Mike, and I wanted to welcome you to Redirect Health. We're thrilled that you decided to join and are looking forward to helping you with your healthcare. Our goal is to make healthcare really easy, eliminate waste, and bring down your out-of-pocket costs. We know that navigating healthcare can be confusing and frustrating, and that's why we're committed to simplifying the process so you can get the care you need without any of the hassle. So we've created an 888 number that you can call at any time if you have questions about your benefits or care. No need to call your doctor or pharmacy. Just call that 888 number, which you can find on any of your member cards or stickers. You can call us 24/7, 365 days a year in English or Spanish, and a member of our dedicated care logistics team will help you with all your healthcare needs. First and foremost, I wanted to share the biggest benefits of your new health plan, and that is that you have a $0 copay and no deductible for primary care and your chiropractic. Really, unlimited visits, as often as you want and as much as you need to. And they're 100% free. That would cover all your routine care, but what about the non-routine healthcare services? We'll talk more about that process in a moment, but for now, you just need to know to call us first, and our care logistics team will make sure that you have a care plan designed to help you get the care you need at the best and fair price. So for your new member orientation today, I want to talk about 5 things that will help you get the most out of your Redirect Health plan. First, I'm going to tell you a little more about that 888 line, when to use it, and why it's there to make your life easy. Next, we'll talk about what happens when you call that number for routine care during normal business hours. Third, I'll tell you more about the process when you need routine care after hours, when most primary care clinics are closed. Then I'll share how we handle prescriptions, so you always get the best prices. And finally, we'll discuss all the what ifs and how our care logistics team helps you navigate the healthcare system when something non-routine comes up, such as a broken arm. So the first thing we're going to talk about today is the 888 line. When you needed care in the past, you would normally have to call your doctor, a specialist, or the pharmacy. What we've done is, we've got the dedicated line. It's 24/7 in English and Spanish. When you call that number, a member of our care logistics team will help you with anything you need and make everything as easy as possible. When you direct your care by yourself, you put yourself at risk for unnecessary costs. That's why we have our 888 line. So when you have questions about your benefits or care, we're right there to answer them 24/7. So the second thing we're going to talk about is what to expect when you call that number during normal business hours. Traditionally, when you need care, you'll call your doctor to set up an appointment, but it might take several days before they can see you. And when they do see you, they tend to make you wait in the office and they collect a lot of information. They're never on time, right? We've all had that experience. Instead of going through all that hassle, all you need to do is call our care logistics team. When the care logistics specialist answers, they're actually going to start your visit right there over the phone. They'll collect your medical history, they'll discuss the reason for your call. All the things that would happen in the office, we're going to start to do over the phone. Next, we'll actually get you on the phone with a provider. Now that provider has all the information they need to potentially diagnose and prescribe over the phone, saving you the hassle and time of driving into the office or having to take time off work for an unneeded appointment. But even if they can't diagnose you over the phone, that's okay because a majority of the visit has already been done. No sitting around in the waiting room or filling out paperwork. All they need to do is take your vitals and take you to the room. Your doctor has all the information they need, and your typical 45-minute visit can now be done in a fraction of the time. From start to finish, it's a completely different experience that saves you time and gets you in and out. The third thing we want to talk about today is when you need routine care after hours. Imagine that you're on your way home from work and you're not feeling well. Just call us. Within 5 minutes, we'll have you on the phone with a provider who will guide you to the right type of care. About 70% of the time, we can provide a diagnosis and write a prescription over the phone. That way you don't have to worry about calling in sick or taking time off work to go to the doctor. We're going to schedule it for you and direct you to the right place of care for your needs. We'll get all the information to them ahead of time, and a member of our medical staff will call ahead and talk to the attending physician to make sure they know the reason for your appointment. So the fourth thing we want to talk about is picking up your prescriptions. Remember that if you have the Everyday Care Plan, we'll get you discounts on your prescriptions when you call us at the 888 line. Generic scripts are normally about $4 to say $25 with your discount, compared to a normal copay of about $15. So sometimes we can actually save you money when you use your discount card. For brand name drugs, we always follow the same process, but as you know, brand name drugs can be more expensive. So please call the 888 number ahead of time and let us help you find the best prices. That means if one of our team members finds a lower price on your prescription at the supermarket rather than the drugstore, we're going to call you and let you know where you can go to save even more. So the fifth and final thing that we want to cover with you is the what ifs. Now we hear a lot of these types of questions. Well, what if I get in a car accident? Or what if I break my arm or something catastrophic happens? These would all require non-routine care. In each of these situations, we follow the exact same process. First, we're always going to get the best care possible at a fair price. We don't want you spending thousands of dollars for an MRI when we know we can get it for a fraction of the cost. Second, we'll look for any government or private patient assistance programs you might qualify for, which means that in many cases, you'll pay nothing. And last, we'll use any insurance you might have, but only if it's needed and saves you money. We're going to start by trying to schedule you a no-cost visit with a primary care physician. Remember, you have unlimited primary care and chiropractic visits. So if a primary care appointment can be scheduled to look at your arm and get an x-ray done, we'll schedule you an appointment right away. But if we can't, we'll look around to make sure we send you to an imaging center with the fairest price. Next, we're going to set you up with a specialist to make sure we set the arm the right way. And we have 18 years of experience using the right doctors, and we're going to get you the fairest price every single time. Then we're going to call you, and we're going to make sure you know every step of the way exactly what you have to do. We actually put you on a special list with something like this. And every day we have a huddle to discuss your case and make sure you know what to do next so you can get the best quality care at the fairest price. One of our favorite parts about this meeting is what we call the energy update, where we share success stories from our members. It's our goal to provide you a great healthcare experience, so you'll want to share your story with us. So let's do a quick recap about your everyday care plan. The first and most important thing to remember is that no matter what, just call us at the 888 line, 24/7, 365 days a year, in English or Spanish. We also talked about what to do when you need routine care during normal business hours and how we streamline that process for you. Remember, you don't have any deductibles or copays for your routine care. Third, we discussed what to do when you need routine care after normal business hours. Just call the 888 line and we'll do our best to get you to the right provider at the right place of service. Next, we talked about the discount program for your prescriptions and how to keep your costs low by getting them filled at supermarkets, not a corner drugstore where prices are sometimes inflated. And lastly, we addressed all the what ifs and how we help you get affordable, high quality care when you need non-routine health services. Hopefully you now have a better sense of what to expect as a Redirect Health member. The most important thing to remember is to call the 888 number whenever anything comes up. Our care logistics team will handle everything from there to make sure your needs are taken care of.